Senior Moments, sponsored by the Empowering Seniors Group on News Talk KVNU, 102 FM and 610 AM.
Good morning and welcome to the Senior Moment Show. We are glad to be back again with another fun show. My co-host Sid is here with me. My name is Bruce Lee. Sid Roeder is my co-host. Good morning, Sid.
Good morning, Bruce.
How are you?
I'm doing well. How about you?
I'm doing well. It's been a little warm out there.
It has, yes.
If you're listening in the wintertime, you know this is a recorded show. It wasn't warm, but it has been at the time of our recording. So, well, we're excited to welcome to our show today Tareen Stewart, who's a pharmacist with Reed's Pharmacy out in wonderful Hiram, Utah. Welcome, Tareen.
Thank you. Appreciate you having me on.
We're glad to have you. We're going to learn more about Tareen in just a second, but before we do that, we'd like to hear about our sponsor, Sid. That's your job.
Absolutely. That is my job. Our sponsor is the Empowering Seniors Group, which is a group of professionals that has dedicated their time and efforts to provide information to seniors, their family member, and really anybody who cares. And they do so via this radio show. If you'd like to learn more about the Empowering Seniors Group, you can do so online at empoweringseniors.info, or you can email us at empoweringseniorscv@gmail.com, and the CV stands for Cache Valley. Or lastly, if you have any suggestions for this show, anyone you would like to see us invite, call me personally at 435-512-6406.
Thank you, Sid. I'm excited about our show today. We're going to learn some interesting things about pharmacies that maybe you're not aware of. But before we get into that, let's learn about Tareen. Tareen, you're a pharmacist with Reed's Pharmacy. How long have you been doing that, and why this industry?
Yeah, that's a good question. I've been with Reed's for a little over a year, but I did about 4 years during my training with that company. And actually come in healthcare, been in healthcare for about 12 years, was a nurse for 10 years, and really loved patient care. Had the opportunity to switch the career field a little bit, and really enjoy the public and community pharmacy that we're having and that we do at Reed's Pharmacy.
And that's quite an education path, is it? Do you get any credit? I'm just curious, for being a nurse at all towards this?
No, I just unfortunately had to start over from scratch. So, yeah, I'm big into improving healthcare on a community level, and I saw that lack in not only nursing but in pharmaceutical. And I'm really happy to be with Reed's Pharmacy. We have a few different options that differ from other pharmacies that make it really enjoyable to work there.
Awesome. You know, here's a super oversimplification of what a pharmacist would be, because when I come up to the pharmacy and I need to get whatever my medication is, I see a bunch of people standing back there and they're counting stuff out and putting them into a bottle, and I think, why would you need to go to school to learn how to count out pills and put them into a bottle? But it's way more complex than that, right? What do they teach you? What is it you need to know to be a good pharmacist?
Yeah, I think the first thing is obviously patient safety. So you can imagine all the medications and available options out there today, and there's always new medications coming out. And not only that, the biggest thing I think is the interactions that are happening out there. And so we're really overviewing the patient profile, making sure they're safe and they're effective. No one wants to take medications that don't help their disease or improve their quality of life, and that's really our goal there. So we're seeing looking over the profile, and then the last thing would probably be the financial burden, making sure it's a feasible option for patients to come in and get the medications they need without breaking the bank account.
So do you also see yourself a little bit as a control organ of some sorts when medications are prescribed and maybe for whatever reason there is some interactions that don't work, to catch that before the patient takes that? Yeah,
absolutely. So it's a big educational thing, and that's why I really enjoy the community setting. I had opportunities to go into, hospital pharmacy where you're behind the doors or you're in the basement, is what they call, and you're really just delivering medications through the hospital system. I like being out where we can educate and make people be aware of potential side effects and how to improve their quality of life, whether it's lifestyle modifications in addition to the medications they can do to get the best results they can have.
On the part of being a responsible consumer, I guess, going into a pharmacy. You mentioned one of the responsibilities, or a big responsibility, is safety. I've always wondered, not everybody gets all their medications from the same pharmacy as possible. I go to one and then go to a different one to pick something else up, or maybe I'm from out of state or something like that. If that's the case, does the pharmacy have visibility on all the things that are going on with me? Or do I need to declare that when I come in to pick up my medications?
Yeah, that's a great question. And that's something we actually ask them to do with their providers as well. The reason being is there's so many different specialties out there now in medicine, so they may be going to different doctors as well as different pharmacies. We really like to be the pharmacy that can do everything to help people out. And we do have access to some data. Anything that's a controlled substance that is going to be highly monitored will come through the state database. We can access that through all the pharmacies. But just your over-the-counter stuff that someone may be taking, or the basic medications like a Prilosec that people are familiar with, those medications we wouldn't have visibility from pharmacy to pharmacy. So patient disclosure is huge in those aspects.
So I should not assume that my doctor understands everything that I'm on, that the pharmacy I go to understands all the things I've been taking. If I'm going to the same pharmacy all the time, they probably will know.
Yeah, and that's a good question. Yeah, that's exactly right. And we can see obviously the numerous prescribers, and so we can see duplicate therapies quite nicely and avoid those where it might be a pain specialist and a family doctor both prescribing an opioid or other medications that they don't have the visibility to know that they're interacting with each other. So we're really the safeguards on that.
So what's the course of action if you, like you just mentioned, if you see that a patient has similar products from two different doctors? Do you call the doctors to correct that, or what happens?
Yeah, absolutely. We're always looking for the safety of the patient. So we would reach out to both providers, get clarification. One, the diagnosis: is this a short-term treatment? Is it post-surgery? Two, what if they were aware of the other prescribers' reasoning for the medication. And a lot of times those are just resolved by a few phone calls and getting clarification and documentation from the providers.
Do you find occasionally that you have to educate the doctors on maybe the interactions of some medications, or do the doctors always have an understanding of how those work?
Yeah, I think we all know the doctors get a good amount of medicine and training in school. And then they've obviously had the practice guidelines they follow. But there's obviously a lot more that goes into it. So as a pharmacist, we study medicine for 4 years. And so we're able to hopefully catch and educate not only the patients, but the providers on certain medications or ways to improve outcomes that they probably haven't thought of when they're normally prescribing like they usually do.
Thank you, Tareen. We're already coming up here on our first break, so I want to give you a quick chance for those listeners that don't know where you're at to give out your location in Hiram and maybe your phone number.
Yeah, for sure. So we're just right when you come into Hiram, we're right next to Ridley's supermarket at 790 East Main in Hiram. And our phone number is 435-245-6348. And also, we are in Hiram, but we are for the whole Cache Valley. We deliver and do everything for the valley.
Thank you, Tareen. This is the Senior Moments Show. We'll take a little break. We'll be right back.
Did you know 10,000 baby boomers qualify for Medicare every day? Did you know that you'll start to get swamped with mail about Medicare 6 months before your 65th birthday? Did you also know it doesn't cost anything to use an insurance agent to help you navigate through all those offers? Hi, I'm Tracy Ferris with Blue Water Health Insurance. Let me help you understand all the offers you're receiving and find the plan that fits best for your situation. Call me today at 435-890-8155.
This is Mark Thurston with White Pine Funeral Services. The best time to plan is when you have time to plan. Having a prearranged funeral gives peace of mind for everyone involved. White Pine will customize your final wishes to fit your needs, from a traditional burial to cremation to a custom headstone. White Pine also accepts prearranged plans from other mortuaries, and we will absorb any transfer or revocation fees. No penalty to you. Visit whitepinefunerals.com or come and see us for more information.
White Pine Funeral Services, here when you need us most. Reed's Pharmacy in Hiram offers free delivery service 5 days a week, Monday through Friday throughout the valley. Just stay home and they will deliver to you. With 25 different suppliers, they won't have the shortage that others might have. Also, with compounding and many other services, they will be able to serve all your needs. In order to stay safe and help slow the spread, please call Reed's Pharmacy in Hiram at 245-DRUG, and they will take care of you.
Whether you have a small business, large corporation, or sole proprietorship, remember Cook Martin Polson has provided quality accounting services since 1977. At Cook Martin Polson, they believe you've earned it, and they're going to help you keep it. Take a minute right now to call 750-5566. That's 750-5566 to set up your tax appointment and let Cook Martin Polson show you how to keep the money you have earned.
This is Jared Ripplinger with Cook Martin Polson. You've worked hard for your money. Let us help you keep it.
Welcome back to the Senior Moment Show. If you're just joining us today, we are speaking with Tareen Stewart. He's the pharmacist with Reed's Pharmacy out in Hiram, and we've been talking about, we've just been learning about more in depth about how pharmacies work and how to be a good consumer and some of the options that are there. We were talking off air a little bit about being a responsible consumer, or how to maximize your role in the purchase of the drugs that you may be picking up versus just the doctor prescribing something to you and walking in and picking up whatever is there. Tareen, can you talk a little bit about, if something is prescribed to me and I'm coming into your pharmacy, what kinds of things should I be thinking about? What should I be asking the pharmacist? And can I save more money? I mean, what kinds of questions should I ask?
Yeah, I think that's a great question. I think one of the biggest questions someone can ask is this the right medication for me? And that should align with the diagnosis from the doctor. It should also align with their health profile, their age, allergic reactions, and their overall health status as well. And those are some really, really key factors as to, one, if the efficacy of the medication is going to work, and then two, if, like we've talked about numerous times, if the safety profile fits for that patient.
So if I come in and I ask that question, I would expect generally you're going to say, yes, this is fine. But let's say it's not. Let's say I come in and I ask the question, as the pharmacist, you're looking at it and you think, yeah, it's not bad, but maybe we should do something different here, or there might be a better option. What happens at that point?
Yeah, we have a lot of contact information and a lot of relationships we build with the physicians here locally. A lot of them trust our decision making and reach out to us many times a day for opinions and or suggestions. And so we would reach out to them and offer some recommendations. Maybe it's a cost issue, maybe it's a safety issue, whatever it may be. We'd reach out and have those avenues opened up so we could see what would be the best option going forward.
And let's dive in the break. Also, we talked a little bit about compounding. Do you want to enlighten our listeners on that subject?
Absolutely. So when people think of compounding, I think it can be very confusing as to what that is. And what I like to kind of simplify it as is individual medication therapy. So what I mean by that is there are bottles and bottles behind the shelves of prescriptions that are made from manufacturers like Pfizer we're well aware of, right? Well, those only come in certain dosages and certain formulations. And so we have the ability as a pharmacist and a pharmacy to compound these specifically. So a certain progesterone or testosterone can be compounded specifically to meet the lab requirements to improve their levels. Or someone who has difficulty swallowing medications and has dysphagia, which is difficulty swallowing, we can make those medications into a liquid form so that adherence is achievable, and so they can get those medications appropriately.
How do I know to ask for that? Because again, I'm probably thinking my doctor knows what's best for me, right? So I go in and I get diagnosed. The doctor says, hey, you should get this medicine, and I'm going to say, sounds great. I'll send the prescription into Reed's. And so I come down and I'm just going to say, I have a prescription in my name. Here it is. I don't know to ask you to compound it, or I wouldn't know to tell you that I have trouble swallowing, or again, how do I know how to interact better with you? That's
a good question. I think really knowing the way that the doctor prescribed it is really important. And what I mean by that is explaining to the doctor, for example, we have a lot of parents that come in with that same type of question and mentality. Hey, my child's 7, a prescription for a pill for amoxicillin was called in. I don't know if they can swallow that amoxicillin. Are there some alternatives? And so just asking questions, and it's our job as a pharmacy. We have a great marketing team that reaches out to the doctors and lets them know what are available at our pharmacy. What are things that we can compound and some that we can't. And there are some restrictions, but overall we can compound probably over 100 different things in our pharmacy, from topical creams to ointments to things like we talked about that you would oral suspensions that you would drink. We really have it all. So
let me also ask you a little bit about other services that you provide. I think most people are aware with flu season coming up and everything that you supply immunizations, but there are other things you can do too.
Absolutely, yeah. So coming the change of the season, obviously fall time, we're going to thinking heavily about flu shots. We also work closely with the health department. We just barely yesterday got the new series of vaccine for COVID as well. So we're always doing those. We're really trying to always stay on top of the game with preventive medicine, and anything we can prevent in the community setting, we offer there. Everything from shingles to tetanus shots to flu shots, to the pneumonia series, which is very important for those in the geriatric population. We offer those services there.
So we learned something, or I learned something else today during our conversation, excuse me, off air, that some things that you need a prescription for, I may not necessarily need to go to see my doctor for. And so if I'm out of a particular medication and maybe I know what that is, or I might be just able to come in and talk to a pharmacist and say, hey, I've got this going on. Can you give me something? The pharmacist can actually write the prescription.
Yeah, absolutely. So we went to some additional training, our pharmacists there, to be able to prescribe certain medications for those scenarios. Come a Saturday night and you have a cold sore flare-up, or a lady has potentially a UTI, some urinary tract infection. We are there to help with those scenarios. We can prescribe for yeast infections, urinary tract infections, cold sores, and strep throat if your child has a sore throat. All those things we can prescribe, and we'd manage completely without the use of a doctor's office. And there's also the cost savings with that as well.
So you do the testing for strep throat too, right? To make sure that that's what it is?
Absolutely, yes.
Are you required to do you do testing too for the urinary tract infection and all of those things?
No. So that's a good question. The testing comes from the strep profile that we do. And then the other one is basically it's going to be a rule-out assessment questionnaire and or patient history that we'll go through and would qualify them as you would get in the same as a doctor's office or an Instacare setting.
Okay, great. Thank you, Taurine. Maybe before we get into our second break, for any listeners that have not caught where you're located in Hiram, would you tell us again and your phone number?
Yeah, absolutely. So we're just the top of the hill when you're coming into Hiram next to Ridley's Supermarket, right across from McDonald's, if you're familiar with that. The address is 790 East Main Street in Hiram. And our phone number is 435-245-DRUG. That is 6348.
And when we come back from the break, we're also going to talk a little bit that you deliver and how far you deliver. This is the Senior Moments Show. We're going to take a little break. Stay tuned. We'll be right back.
Did you know that one of the greatest threats to our quality of life is a fall? 1/3 of Americans 65 and older, and 1/2 of those over 80 will fall this year. Many will never be the same again, and some will never return to their homes. This is Bruce at Comfort Care. One of the ways we can help people stay in their home is through our free in-home fall protection survey. Let us help you identify these fall risks. Call us at 754-7676. Comfort Care, 754-7676.
Is your pharmacy closing? You have a choice of where to transfer to. May we suggest Reed's Pharmacy in Hiram? Reed's Pharmacy was named Best of Northern Utah, Silver Medalist Pharmacy. They have been open for 52 years and offer free prescription delivery to all of Cache Valley. Just stay home and they will bring your prescription to you. Need help remembering to take your meds? They have a free bubble packing service for convenience. For more information, call Reed's Pharmacy today at 245-DRUG.
You have a lot of options when it comes to buying or selling a home. Do you list it online, sell it yourself, or do you have a realtor help? It's a major financial and emotional decision. A realtor is the liaison between buyers and sellers and really helps you navigate complex contracts, deadlines, and disclosures.
Hi, this is Sid Roeder with Achievement Realty.
I work for you to get the best outcome for your situation. Let me earn your trust with a free consultation and a free market analysis. Call me today at 512-6406. Then list it, sell it, and move on.
This is Brian Erickson for the Sunshine Minute. Each day, our nurses, CNAs, cooks and servers, housekeepers, laundry staff, music, recreation therapy teams, office staff, receptionists, and many more arrive around the clock. These heroes show up ready and willing to serve and protect our residents and clients. We are so grateful to our dedicated team. On behalf of the Board of Sunshine Terrace Foundation and our community, thank you to all of our employees for keeping us safe. We bring more to life together.
Welcome back to the Senior Moment Show. If you're just joining us today, we're talking to Tareen Stewart. He's the pharmacist out at Reed's Pharmacy in Hiram, Utah. And if you're listening and you're in Cache Valley, you might be like, Hiram? I live in Richmond. I'm not driving to Hiram. That's too far. How would you answer that?
I would answer that question with the fact that I do live in Richmond, and Hiram is a far distance for anyone to travel. And we obviously know with gas prices and the changes in the economy, we want to accommodate as best we can. And we have many individuals in long-term care facilities or geriatric populations, or even those post-surgery that can't make it to the pharmacy. Their health prohibits that, and so we're there to deliver across all of Cache Valley, not just Hiram. It's a free service we offer, and we're doing it 30 to 40 times a day. We're out and about delivering to people's homes and or facilities to help them out.
So what's your turnover time there in principle? Is it always within 24 hours that something gets delivered, or how does that look?
Yes, we try to do that within 24 hours. Most things we know in advance because they're scheduled medications, but let's say post-surgery, a pain reliever and or antibiotic comes in, we can definitely deliver that and try to get it to them same day. We also do hospice kits for many of the facilities here as well, those that are on hospice status. So we're really try to have a wide variety of options that we offer and make it most convenient for the customer so that it's not an inconvenience at all to get their medications.
So if I'm planning ahead and know that I need my medications delivered, what's the cutoff to get them on the same day? And what's kind of the geographic area that you're willing to do same day versus, I'm assuming that at some point you're probably going to drop it in the mail instead of putting somebody in a car and driving it to me. What does that look like?
Yeah, we try to accommodate pretty much to all of the valley, but there are some areas, outskirts, that would take an extra 15-20 minutes per delivery. So most those days, so we try to go out we're on the south side, so we try to go up north to that area, Smithfield, etc., Hyde Park, North Logan, at least 2 to 3 times a week. And so normally if it's an off day, we'll have that medication delivered to those individuals the next day. And anything in Logan and or the south side, it'll usually be same day. Usually if we get the prescription in by early afternoon, 1 o'clock or so, we can usually have it delivered by that same day at late afternoon.
Tareen, we've talked a lot about delivery and different things. I'm almost not sure if there's anything left that we haven't touched on. Is there anything that you can think of that is important to our listeners?
Yeah, I think one thing I really emphasize is adherence of medications for individuals. It's so important that they take their medications as scheduled to get the most benefit. And so one thing we really emphasize there at the pharmacy is a medication sync program, which means we just simply try to line up all your medications the same time every month. And that way we can maybe do the delivery we talked about every month on the same day, and you're not making multiple trips to the pharmacy. We also do a bubble packing system that is state of the art. It's extremely easy. It's portable. It's packaged nicely. It's clear and concise, and we can have those set up and delivered to individuals that are having a hard time with, filling their medications or the pill reminders and those type of things that just don't work for some people.
So whenever I hear additional services being offered, my first thought is, well, what are the costs going to be associated with that? Are you guys able to do that for a reasonable additional cost, or how does that work?
Yeah, so if the individual's taking 4 or more medications, which is actually not hard to meet nowadays, right? There's a lot of medications out there. So 4 or more medications, we will package those and set them up on our program for free, and then deliver that as well for free. So there shouldn't be any additional cost associated with that. And that's our goal. And we know as fall time comes, weather's going to change. And even though it's been hot, it'll get nasty cold here. And so we want to be able to have our delivery drivers out there doing the service for individuals that can't make it out. So there really isn't a reason why in Cache Valley you couldn't go through Reed's Pharmacy to get your services and or medications done.
So let's maybe circle back really quick to immunizations with fall coming up. Do you have different, is it the same immunization for the flu this year, or is there options? How do you deal with that?
Yeah, we have a few different options. We talked about the COVID vaccine. We have the flu one as well. We have the standard flu shot, and then we have one that's designed for those over 65 or older. And a lot of pharmacies have a hard time getting that. We have that one in stock, and we work hard to keep that in stock. It's a different dosing for those in the geriatric population. And then we also, as far as that the vaccines go, we also do a lot of clinics, outreach services, where we'll set it up at different facilities and or businesses and bring those services to your workforce. So you could, on your break, get a flu shot, or after work, get a flu shot without leaving your building.
So if I'm going to walk into the pharmacy and want to get that flu shot, what do I need to bring? Can I just show up?
Yeah, you can just show up, walk on in, bring your identification if you have that, and insurance card. And that's all you need. No appointments necessary.
Thank you for coming in today, Tareen. Maybe before we end our show, one last chance to share your location and your phone number, please.
Yeah, thank you. Yeah, we're in Hiram, Utah, although we do deliver throughout the valley. 790 East Main, Hiram, Utah, right there on Main Street next to Ridley's Supermarket. Our contact info is 435-245-6348. That's 245-DRUG. And also our webpage is reedspharmacyutah.com. Great website to pull up more information about our services.
Thank you for coming in, Tareen. I think we learned a lot today. This is the Senior Moment Show. We are sponsored by the Empowering Seniors Group. If you would like to learn more about the Empowering Seniors, you can do so online at empoweringseniors.info. We're at the end of our show. We hope you tune in again next week.